Good afternoon, everybody, and welcome to the ARK Seminar series, the first for 2008. ARK is a joint resource between Queen's University Belfast and the University of Ulster, aiming to open up access to social and political information. Part of the activities undertaken under ARK is the Northern Ireland Life and Times survey, which has been running for a number of years now in Northern Ireland, and today's seminar will draw from some of the material from that survey. Our format for today is that we will have a presentation by Dr. Anne-Marie Gray, and I'll introduce Anne-Marie now in a minute, for about half an hour, and then we'll have an opportunity for questions, discussion, comment, or whatever you want to do for 15 or 20 minutes, and then there's a light lunch served out in the foyer where you're welcome to join us and continue conversations or discussion if you want to. Dr. Anne-Marie Gray is a colleague of mine at the University of Ulster. She's a senior lecturer in the School of Policy Studies, and she's policy director with ARK. She has been involved in teaching in the whole area of health for a number of years and has written on attitudes to the health service in Northern Ireland in the past. And in this particular seminar, she's taking the opportunity to compare the situation in 2006 with what the picture was in 1996. So a decade later, how have people's attitudes changed, or have they changed in relation to the NHS in Northern Ireland? So without any further ado, just to welcome Anne-Marie. Thank you for preparing this, and we look forward to hearing what you have to say.
Afternoon, everybody. As Gillian said, I'm going to look today at attitudes in the NHS in Northern Ireland in two specific years. In 2006, using data from the Northern Ireland Life and Times survey, and then 10 years earlier, in 1996, using findings from the Northern Ireland Social Attitudes survey. And occasionally some comparison will be made with attitudes in Britain. I think the first thing that I should point out is that between 1996 and 2006, the health service in Northern Ireland has been the subject of enormous debate about its organisational structure and about rationalisation, particularly of acute services. And on the overhead here, you'll just see reference made to several of the reviews and document publications during that time. It's also been subject to pressures which have been evident right across the United Kingdom, such as increasing demand, increasing public expectations, concern about waiting lists, staff shortages, and of course worries about MRSA in hospitals and such like. Just might be useful for a moment or two to look at, to take note of some of the issues that were raised in these documents between 2000 and 2006, as they may have influenced, we can't be sure, but they may have influenced public attitudes to some extent. In 2000, the Acute Hospitals Review proposed the streamlining of structures in Northern Ireland and the setting up of a new regional statutory health and social services authority. But it also, of course, recommended quite a severe degree of rationalisation in terms of acute hospital care, and that's always been a controversial and a sensitive issue in Northern Ireland. And certainly Dorothy will remember when we looked at attitudes to healthcare around a different set of issues in 2001, that was one thing that people were very concerned about and felt that they didn't have sufficient say in. In 2002, Developing Better Services report was published, and this really stimulated discussion about the functions of trusts and other bodies, and picked up on the rationalisation issues which had been first set out in the Acute Services Review of 2000. And in particular, I think it raised the whole debate about services in the west of the province and between Omagh and Enniskillen, and which of those areas was to have an acute hospital. Healthcare then was subject, as were all public services in Northern Ireland, to a degree of uncertainty around what was going to happen as a result of the review of public administration. And as a result of this paper, this review paper in 2003, the implementation and decisions specifically about health service were put on hold. I think for a time it looked as if health was to be treated as a part of the review, but distinct at the same time, given that there had been quite a high degree of of previous planning around what should happen to healthcare. Inevitably, though, the review of public administration was going to be looking at whether or not the number of quangos in Northern Ireland could be reduced. It was going to be looking at the potential for cooperation between local government and other agencies, so I think it was almost inevitable that the healthcare services were going to be affected by that. Then in 2005, John Appleby carried out a review of the resourcing of health and social care in Northern Ireland, and he recommended the separation of commissioning and providing functions, which he felt was necessary to encourage higher performance in Northern Ireland. And he was critical of the fact that in a number of areas he felt that clear enough targets had not been set by government in Northern Ireland, and certainly there hadn't been sufficient monitoring to ensure improvements in waiting list figures and so on. And then again in 2005, another review document from the RPA team, this time including proposals for the restructuring of health and social care. Looking, I think, largely at the desirability of having shared boundaries between the new local councils which are going to be established and the new health and social care bodies in order to facilitate partnership. And in fact, the final proposals issued by the RPA in 2005 seemed to depart from that review document. And I think it became clear at that stage that the number of health bodies was not going to be the same as the number of local governments, and that the review of public administration was really out of step and behind what was being aimed to achieve in the review of health services in terms of timing and so on. So we do get this period of a lot of uncertainty about structures. And in the middle of all that, we have, as I said earlier, the same concerns that are evident right throughout the United Kingdom in terms of waiting lists particularly, but also in terms of what's going to happen to GPs, new GP contracts, the setting up of the new local health and social care groups in Northern Ireland. Across the United Kingdom, when Labour came to government in 1997, they inherited the lowest satisfaction ratings with the NHS ever recorded in the British Social Attitude Survey. And Labour government made healthcare a high priority. And of course, a new policy course was set by the National Health Service Plan in 2000. And this was followed by high degree of investment, an introduction in England of very strong control and command systems. But we also, at the same time, had the setting up of devolved administrations in Scotland and Wales, and albeit laggardly and slowly in Northern Ireland. And I think the result of that has been that since 2000, new Labour policy in healthcare has essentially been English policy in healthcare. And there has been an opportunity for Scotland and for Wales to depart from that policy because of their local administrations. I think we've seen that in respect of Scotland not really taking on the strong managerial performance management system in the same way that England did. But that has led to questions being posed about whether we can or how long we can talk about a national health service, given the differences and perhaps the differences still to come across the devolved areas. And I think that will be one thing that will be very interesting in the next number of years, would be to chart those trends in public attitudes across the United Kingdom. But what then about attitudes in Northern Ireland? This table gives information on attitudes relating to the overall running of the NHS in 1996 and in 2006. Now, I would say at this point that satisfaction figures for the overall running of the service have always been lower than for specific aspects of the service. Now, we do see that in Northern Ireland people are slightly more satisfied with the overall running of the service than they were in 1996, but there's still, a lot of people, 45% of people who are quite or very dissatisfied with the overall running of the NHS, and that's maybe perhaps not all that surprising given the ongoing uncertainty about structures. Looking then at some of the primary services, at satisfaction with GP and with dental services. As you can see, satisfaction with GP services is still high. So people in Northern Ireland, 79% of them are quite or very satisfied with the services that they get from GPs. Now there's a reduction on the 1996 figures, but 79% is arguably still expressing very strong support for GP services. In terms of NHS dentists, 65% of people in 2006 are quite or very satisfied, and again that represents a drop on the 1996 figure of 71%. Going to come back maybe to look at some of the explanations for that in a moment or two, but if we just first of all briefly look at a couple of other services, inpatient and outpatient services, we see here that satisfaction with inpatient services has gone down from 62% to 54%, and I think undoubtedly some of that decrease is probably linked to concern about waiting lists. And then satisfaction with outpatient services has marginally increased from 60 to 61%. So not all that much change in respect of outpatient services. Just want to look a little more closely at satisfaction with particular aspects of GP care. We've got this overall satisfaction rating which is high, but if we look a bit more closely at what people are happy or what they're most unhappy with, we can see that the GP appointment system is one of the areas where there's a lower degree of satisfaction, 52%, and declining slightly on the 1996 figure. Now what we're unsure about, because we don't ask people, is whether or not some of that may be related to the out of call at GP or primary care service. And I know certainly research in England has shown that that's an aspect of GP care which people are least happy about, and the fact that they can't get to see their own GP out of hours and so on. People are slightly happier with the amount of time given to patients by GPs, and the quality of medical care provided by GPs continues to be very high at 74%, and a decline in the number of people who feel that they're able to choose what GP to see. So just to summarise that, in terms of GP services, the least satisfaction with the appointment system, but continuing high satisfaction with the quality of care, and a slight increase in the amount of time given to patients, but less happy with the choice they have in relation to GP. Just before I move on to that, let's say something about the attitude to NHS dentist care. I think I was quite surprised to find that 65% of people in Northern Ireland were still satisfied with NHS dentists, given the debate and given the media focus on this. And in fact, in September 2006, just before our survey was in the field, a BBC headline was Northern Ireland dentists turn backs on NHS. And that featured a warning from the British Dental Association that hundreds of dentists in Northern Ireland were considering leaving the service because of the difficulty of covering their costs. And of course there's also been considerable media coverage in England of difficulties of people accessing an NHS dentist. And in fact, around this time, the television coverage in England was showing a queue stretching back 1.5 miles of people waiting to register with a National Health Service dentist. So I think the executive would probably be fairly pleased at this degree of satisfaction currently. Because of concern, though, in November 2006, the department in Northern Ireland did announce a new dental strategy aimed at making it easier for people to get treatment on the NHS. One thing I also want to note at this stage is that I'm looking at attitudes in two specific years, in 1996 and 2006. What we don't have for Northern Ireland is attitudes to these services between those years. Now we know from the British Social Attitude surveys in Britain that attitudes fluctuated quite a bit between 1996 and 2006. And it may be that these 2006 figures that we're looking at actually represent an increase or a decrease on the figures, say, from 2000 2001. And this was the period in Britain when dissatisfaction peaked. So people were most unhappy with the NHS in 2000, 2001, and we don't have data from that period to tell us how people felt here. So how do attitudes compare with attitudes in Britain then? You can see that in both Britain and Northern Ireland, people are a bit more satisfied with the running of the service than they were in 1996, but it's still actually well short of even 50%. As I said earlier, satisfaction with specific aspects of the NHS has always been higher, and that's been the picture across the UK, and again we see that reflected here. In 1996, when we did this work, people here were more satisfied than people in Britain with respect to all of the areas we looked at. And that continues to be the case with the exception of the running of the NHS overall, where more people in Britain are satisfied, slightly. I think two points are worth looking at here. There continues to be quite a strong difference in attitudes to NHS dentists between Northern Ireland and Britain, and that's something that we might expect to see, I think. In 2005, the data that the British Social Attitude Survey data that we're using here, that was the lowest level ever recorded with satisfaction with NHS dentists in Britain. So to see that low figure is not surprising then. There's also been a slight improvement in satisfaction with outpatient services in Northern Ireland, but a 3% drop in Britain. What we also know is that the figures for Britain, with the exception of inpatient and particularly NHS dentists, do represent an increase in satisfaction since that very low point in 2000, 2001. And GP services, though, whilst they're receiving still fairly high satisfaction rates in Britain, have never really recovered from a drop of 76% pre-2001 to 71% in 2001, and now that satisfaction with GP services sits at about 72%. So satisfaction in that respect has not recovered from those low figures in 2000, 2001. One of the issues that we see a lot of discussion about, a lot of debate about, of course in our media here, is waiting times. And waiting times have been consistently seen by patients and the public as a problem for the NHS, although they have been a feature also of the service right from its inception. Now, it has been the case that here in Northern Ireland, patients have experienced longer waiting lists than in other parts of the United Kingdom. And in 2005, just before we carried out the latest survey, we had some of the longest waiting lists and waiting times for inpatients and for outpatients. So people had been exposed to a pretty bleak picture before they responded to our survey. If we look first of all at waiting time for appointments this is a first appointment with a consultant. 1996, 45% of respondents felt that needed a lot of improvement. And in 2006, just slightly more people felt that it needed a lot of improvement. We do see fewer people feeling that it's in need of some improvement. And if we combine those figures, then we actually see a small decrease in dissatisfaction levels. But that's still, what we're still seeing there, a lot of people who feel that waiting times need a lot of improvement. We can see a similar picture here in relation to waiting time for non-emergency operations. So 39% in 1996 feeling they need a lot of improvement, 40% by 2006. Again, the numbers who feel that they need some improvement, there's a 9% drop in 2000, more than a 9% drop? Yeah. More than a 9% drop in in 2006 figures. So again, when those figures are combined, there's a slight decrease in dissatisfaction. But what is quite interesting there is that the people who feel the strongest remain pretty much the same for the 2 years. So that over 40% of people who feel that those waiting lists need a lot of improvement has got worse, it hasn't got better. For accident and emergency services, we do see quite a big increase in 2006 in the number who feel that those are in need of a lot of improvement, and then a reduction in who feel they're in need of some improvement. So people seem to be a much stronger viewpoint that accident and emergency services really need to be addressed. What can we say about these waiting times? Well, By 2005, we know we had these long waiting lists. 1 in 10 of the population was waiting to attend a first outpatient appointment in Northern Ireland. Between 2000 and 2005, the number of non-emergency admissions fell steadily from the and that had been the case from the mid-1990s. Now that was certainly going to contribute to increasing waiting lists and waiting times. Whether or not these figures improve because of what the government's doing now, I think we can look at that in a moment. When John Appleby carried out his review of the financing of health and social care, resourcing of health and social care rather, he was particularly critical of the targets that had been set for Northern Ireland for the reduction of waiting times. He said they weren't ambitious enough, that they hadn't been well monitored and so on. There's a notable gap in the goals. But he also showed that the Northern Ireland waiting list could be accounted for by a small number of trusts and by a small number of specialities. But of course, that's not what we're seeing here. We're seeing quite a big percentage of the Northern Ireland public who are dissatisfied with these services, which may say something about media attention as well. Perhaps if we were to do this survey again, ask these questions again in a couple of years' time, we may see more positive attitudes. What I have on this slide is the extent to which waiting lists have decreased recently, and particularly in the last 9 months to a year. So the inpatient waiting list figures have been coming down since 2002, but there has been, just between September 2006 and June 2007, that decrease of 11.8%, which is significant. Just to give an idea of figures, that means nearly 36,000 people still waiting. In terms of people waiting for a first outpatient appointment, those waiting lists actually increased between 2002 and 2007. But interestingly, our figures were showing just slightly more satisfaction with the outpatient waiting lists. So, again, though, between September 2006 and this time September 2007, there's been this big decrease of 51.2%. So the government has really been focusing since the end of 2005 in getting these figures down. And the minister, the direct rule minister at that time, set much more definite targets in relation to the reduction of waiting times, and has attempted to hold trusts to much greater account for not meeting those waiting times. What we also don't see here is those waiting list figures disaggregated in terms of the number of weeks that people are waiting or by speciality, and that tells a more complex but a different picture as well. Interestingly though, I wouldn't be so sure that if we were to do this survey in a couple of years' time, we would see a massive rise in public satisfaction. Certainly if Britain's anything to go by, we won't see that for some time. The attitudinal data from Britain suggests, and of course the figures all show this, that while waiting lists in England have been coming down for some time, it's taken a long time for that to be noticed by the public. And even at that, the British Social Attitude Survey is now beginning to show that there's some recognition of that. But there's still 3/4 of people asked in 2005 still felt that their government needed to do more on improving waiting lists and waiting times. And the data in Britain has also shown that people believe waiting times to see consultants for specific procedures are quite a bit longer than they actually are. So people don't recognise the improvements that have been made. Now, whether that's because the government doesn't do a sufficiently good job at promoting good news, or whether, of course, as tends to be the case, it's the negative headlines that grab the attention in the popular and public press. So if we see this pessimistic picture in terms of public attitudes in relation to waiting times, is the picture any more positive in relation to the quality of care? Well, let's have a look at that and see. Comparing 1996 and 2006 figures, 72% of people believe the quality of medical treatment provided by GPs to be very good. So that figure that we're seeing there hasn't changed in 10 years. Satisfaction with the amount of time a GP gives to their patient remained very constant as well, 61%. We still see, in terms of nursing, nurses, 58% of people believing that staffing number of nurses needs to be improved in hospitals, and 59% believing that the numbers of doctors needs to be enhanced. But you'll see there that that's really quite a significant drop on the 1996 figure, when well over 70% in both cases believed that those staffing numbers needs to be improved. And I think that does reflect spending on staffing in Northern Ireland. But the other 2 points, the latter 2 points are interesting as well. While satisfaction with the quality of medical treatment in hospital has remained pretty much the same, 62 and 61%, satisfaction with the quality of nursing care has come down from 71% to 64%. And I'm not entirely clear about what factors might account for that. Might be something to do with public perception of what nursing should be about, and the fact that you do hear people saying often in the media that nurses don't have time now to do the things that they ought to be doing, like talking to patients or making sure that beds are clean and that wards are clean and so on. I'm really not sure whether it's a reflection perhaps at a time in Northern Ireland around the survey time of the increased use of agency nursing or temporary nursing or so on. I think we didn't ask that question, so it's difficult really to hazard a guess at that, wouldn't want to do that. What we do know as well is that with the exception of GP care, respondents who had recent contact with the with services were more likely to be satisfied. So for example, those who had recent inpatient contact, where 61% of those people said that they were satisfied, compared to 48% of those who had no recent contact with the NHS. So apart from GP services, where satisfaction is still very high, we do see a correlation between recent contact with the NHS and the degree of satisfaction which people have. And I think, again, that might support this idea that sometimes people who have not had contact with services are led by what they see in the newspapers or what they hear in the media, and where people have individual contact, that increases satisfaction levels. What we don't know from the data which we have, and I think would be quite interesting to look at, is a more in-depth exploration of the reasons for satisfaction or dissatisfaction. Attitudes, I think, if we look at other research, we can see that are sometimes linked to prior expectations that people have, but particularly in the UK, to the very big growth in public expectation about people, what people feel they should be able to get from the NHS and when they should be able to get it. Maybe linked to individual experiences, as we said, perhaps to the degree of choice which people feel they have, or to media coverage. A lot of the data which I've looked at identifies concerns about the NHS, but despite that, we still have this strong support for a universal service. That is a service which is available to all, and access is not linked to income. So 73% of respondents opposed the idea that the NHS should be available only to those on lower incomes. And that's very similar to the 1996 figure of 72%. But the age group most likely to support a more selective service was the 18 to 24 age group. So 35% of that age group were more in favour of a more selective service, and what that may mean for the future will be interesting to monitor as well. And of course, at the other age of the age spectrum, people over 65 were very, very strong in their support for a universal service. There's other indications as well of support for a universal service here, in that the number of people with private health insurance is still quite low. Having said that, it has doubled from 8% in 1996 to 14%, or almost doubled in 2006. If we look at the age group of the people who are most likely to be covered by private health insurance, it's that 45 to 54 age group, and that was also the case in 1996. Now, what has changed is that more people in 2006 had the cost of their insurance, private health insurance scheme, covered by an employer. So 39% of people in 2006 compared to 26% in 1996. Now, we do have to be a bit careful here in terms of relating this to the use of private health care, because of course private health insurance is not an adequate measure of that. People may choose to pay for a private consultation or a procedure, and figures in Northern Ireland show that the number of inpatients treated privately has increased by 13% between 1994 and 2004 in that 10-year period, and the number treated privately as outpatients increased by 42%. And as Appleby identified in his report, more private treatment is carried out in NHS facilities in Northern Ireland than in England and Wales. So we do see increases in private treatment, which may, build up a picture of more people using private health care than the numbers having private health insurance would indicate. What we didn't look at either in this module was people's views on public and user participation. And I think this is becoming really a very interesting area, given that we've had this recent reorganisation of structures in Northern Ireland, which doesn't really make provision for that in the same way that government has done with the NHS in England, where very, very comprehensive arrangements have been rolled out over a number of years, and new bodies have been introduced to enhance accountability to users and to strengthen the user and public voice and participation. And that includes most recently the stronger requirement on health and local authorities to involve communities in the planning and development of services through 150 new local involvement networks. And this has been a very strong feature of NHS policy in England, right from 1997, and in fact even before that. Now, I think that perhaps does raise questions about the extent to which the health service in Northern Ireland is or can be patient responsive in the context of the current structures. To what extent do they allow for that? We know that it's something people here are concerned about. In 2001, when we asked that question, the majority of people said they wanted to be involved in decisions about healthcare. At that time, over 50% did not feel the government had got better at involving them. And I suspect if people were asked those questions now, that number who were saying that would be increased, and we've pending, I think it's perhaps open to negotiation again, but certainly the government did announce the abolition of the 4 health and social service councils to be replaced by 1 regional authority. The Minister is having another look at that, which would seem to reduce rather than enhance the potential for public and user participation. So just to finish then, probably went on too long on the key points. More people in 2006 are satisfied with the overall running of the service, but that figure is still quite low. Satisfaction levels with key aspects of the NHS have not really improved significantly since 1996, despite the increased spending, despite the better staffing numbers. Some of that here may be a reflection, you could argue, on the uncertainty, on the amount of change and so on. But we do get this picture in Britain also of satisfaction not keeping pace with progress and developments in terms of outcomes. And support for a universal service remains high, so people are not rejecting the idea of a national health service. But we've got that 35% figure in the 18 to 24 age group, which are saying they're more likely to support selective services. Okay, thank you.
Okay, well, thank you very much, Anne-Marie. It's not an area I've been working in myself recently, so it's very interesting to see the changes that have happened. And I was particularly taken with your big macro question about can we really talk about a national health service given all the differences between the regions. But anyway, let me open the floor to the audience. If you want to make some comments or comment or ask a question, please feel free. What do you want me to do? Move Anne-Marie back up to here? Okay, Anne-Marie, we're under control from the back of the room. Okay, so are there any points? Yes, please go ahead.
Thank you very much. Sorry, Sarah Moore, British Medical Association. Just curious. Hi, Sarah from the British Medical Association. Just curious to know, what are you going to do next? Are you going to look at attitudes as to why they've come up with these attitudes? What's the reasoning behind it? Does anyone
Well, the Life and Time survey is it's a structured quantitative survey which wouldn't allow us really to do that. But I think it would be interesting to look at building on the attitudinal data that we get in the Life and Time survey with some more qualitative work with people about their attitudes, which would give us, I think, a lot more insight and build on these very good survey statistics that we have.
Are there any plans to do that?
Not
Who do we need to lobby?
No, but it's something we ought to be thinking about, I think. Leslie?
Are there any international figures? Are there any international figures? Can you hear me?
Yes, I can.
Are there any international figures that you could compare the UK with? Because, I mean, it's okay just sort of saying the satisfaction levels would be quite good just to compare with other countries.
Yes. I'm not sure. Lizanne maybe knows if there's international survey data. There would certainly be research on public expectations, which would show that expectations across the European Union certainly have been increasing and have been outpacing probably the resources which most countries have and which most countries feel they can supply now. So we've seen quite, as you know, quite a lot of retrenchment in countries related to economic constraints and so on. But yet, people have much greater expectations now. I don't know, Lizanne, do you know if there's any international attitudinal data?
I don't know many stuff. It would be quite difficult to harmonise those questions.
Yeah, because they are specific to structures. Yeah.
There's nothing that I know of that you could really use.
Quite interesting that it is right that all the satisfaction things in the States and in Canada they tend to be for a particular group of hospitals.
Yes.
And they tend to be patients.
Yes.
The whole idea of what is the public think
Yes.
about it, in a sense, reflects, I think, UK public funding. We see it as politicised maybe in a way. Well, obviously it's becoming much more so in the States with elections. But, just that
That's right.
different kind of approach to the thing, I think. Can I ask you, just when I'm on my feet, as it were, can I ask you a specific one? It's interesting in the figures, sorry.
Kath, I think with my big voice, everybody can probably hear me anyway.
It's for the recorder at the back.
It's for, oh, right, okay. I speak for the public record. Good. The figures that you quoted about the increase in use of the private sector. Now, does that figure include private sector work commissioned by the trust?
No,
it doesn't. So that's
No.
specifically
Yes.
individuals.
Yes.
Thank you.
Yes.
That is helpful. And finally, I think the comment that you made about patient and public involvement is extremely well taken, because I think you're right that the fact that the lag in things have got better, and they've got hugely better. Sorry, I should have said who I am. I'm Dorothy Whittington, and I'm a non-exec on the Northern Health and Social Care Trust, and I can speak from that experience and say that if you do look, for example, at the length of time people spend in A&E departments, the change is absolutely extraordinary in the last year. But if you went out today and asked people, I doubt they would know that. And even if they did know it, there might even be a perception that we were cheating.
Yes.